Krasic, director at NanoPsy. Bo, do you want to introduce yourself and just sort of tell the audience a little bit about what's happening here?
Absolutely. Nice to meet you all. Thanks for joining us. My name is Bo Krasic. I'm a director and one of the original co-founders of NanoPsy. Give you a bit of background, not on myself. I don't think it's very necessary. It's been capital markets, money raising, putting companies together and taking them public for most of my career. On the investment banking side, decided to go on this alone a few years back and really focus on the issuers that need debating and or early stage capital. Here we are about 6 months ago, sitting down, and the genesis of this company came together because Dr. Max Revella and myself have been working on a couple projects together and really recognized the need for delivery technology in this space. Generally speaking, in every pharma space, there's a need for delivery technology. We found something that Max has been working on with his collaborators down in University of California, San Diego, and is based off of nanotechnology, and they call them nanobols. So really what we're trying to accomplish here, without getting into the details, and I was hoping Max was going to be here to explain the details of how this technology works and really get everybody excited. Unfortunately, I can't do that as well as he can. But I can tell you that really what we want to do is work with everybody in this space that has the need for typically three things: either working with solubility issues, which sometimes is not an issue in psychedelics. It's bioavailability issues, and obviously delivery and dosing. And that could be a big issue with psychedelics as far as we know, as far as we have read the research on so far. And we are really trying to solve that problem, really work with anybody that wants to work with us in that space. So we have a patented technology around this nano delivery technology, solubility and dosing. It's been proven out, the proof of concept has been done, and a patent has been granted to Vessel, who's our partner in this, and we have the exclusivity for psychedelic compounds of any kind and any sort, really. That is the agreement that we have with them. And we have access to a DEA-approved lab down in California, where we can conduct all the research with Schedule I drugs and narcotics. The first one we're going to attempt to work with will be LSD. It's not going to be so much on solubility, but mostly on targeted delivery and also titrating or slow release or high release. We'll see where the research leads us. The research won't take too long. It's a proof of efficacy more than a proof of concept. As mentioned, this has been done before. We have done animal testing with the actual technology. So think about our technology as a vehicle. What you put in the vehicle is, still has to be acknowledged that it works. In this case, we do believe strongly that it will work, and this is the reason why we did our raise of 500,000 in order to prove the efficacy. Don't know what else to get into to get everybody sort of excited and or give them a little bit more knowledge and background, but maybe we can, if anybody has any questions, we can talk about that. I can answer, or hopefully answer them.
Yeah, I was wondering maybe in terms of like the development of the company, it's it's a startup in its genesis stages. Do you want to tell us a little bit about the team and the bench strength, people that you have kind of behind the business right now?
Absolutely. So I won't talk about myself, but I will talk about the guys that that have strong links. So Max Revella is our scientific advisor, or scientific development advisor. He's been a researcher for about 32 years at the University of Quebec, to Montreal, and a commercial career across 13 companies from advisory to executive level roles. He was a lead recruiter compounds for Sanofi for over a decade. Went through a couple name changes, obviously, with the company, and it has 96 scientific publications and 24 scientific reports. And he was a guest speaker on conferences, and he's very well renowned here in Canada. And he's currently working on a couple of projects with University of San Diego, and that's where we got the technology from, obviously. And this is to do with antiviral technology for not antiviral technology, but for COVID-19. It seems like everybody's been on that. We have Dr. Ratnesh Lal. He's the head of development and discovery for our company. He's the actual person who is on this patent, discovered this. He's, if you look him up at University of California, San Diego, you will see that he's established the newly Center of Nanomedicine at the University of Chicago as well. He's got a high H index, and he's been fortunate enough to partner up with Sunil, who is our director of operations, and he has brought this technology to us. They have many things under their belt, such as actually drug, not only drug discovery, but also drug development. He's worked for Roche, he's worked for Pfizer, he's worked for Santo, and they've also done a lot of on a private side. They have another company that does drug manufacturing, so APIs, etc. So those are really the key members. We have a few more that will be joining us. On the advisory side, we won't disclose them yet, but it's come as a result of this capital raise that we've done. So that's, we will disclose that further down we go. As you mentioned, it's very early stages, but it's not just a very early stage idea, let's say.
Yeah, fair enough. Yeah, and you mentioned that you've already done a proof of concept. Do you want to maybe just sort of we don't have to get too deeply scientific, because anything with nano in front of it, I'm pretty unqualified to talk about. But do you want to maybe just sort of walk through the processes of how your technology works, just sort of from a fundamental level?
Yeah, absolutely. So if you think of nanobows, they are carrier vessels, and what we do with them is we're able to charge internally and externally the molecule itself, the carrier, while the API, let's say, or the good carrier molecule is inside, and essentially what we do is it can be within minutes with a magnet. It can be specifically localized to any part of your body. Not only can we obviously do it in the brain, where for most of these psychedelics is where you want to be delivering your compounds, but there is some research actually going out of University of California, San Diego, where we're talking about phantom pain in people without limbs, right? And that also be targeted, because this was specifically made for, initially was the train process was behind cancer drugs and delivery, for localized delivery. What's really also interesting is that not only does it work in increasing solubility, because it's small, we can also, because it's charged on the inside and the outside part allows you to obviously localize it. The inside part allows you to release or stop releasing the compound. So that's where it really becomes interesting when it comes to psychedelics. And I don't know if I mentioned, when you're dealing with actual, over delivery, or, as I call it, drinking through a fire hose, which can be the case in some of these natural compounds. So we have done this study, or they have done this study with already prior to filing their patent. And on our presentation, you can see the fluorescence data that shows the localization of this technology by using magnets. And it's really talking about, I think we're still on. Sorry, I just saw I lost Patrick. So hopefully I can just keep on going and nothing has disconnected. So really, the proof of concept has been proven, works, and anybody that's interested can obtain our presentation. You can see it on page 19 and 18 of our presentation. The proof of efficacy, as we said, is just to see how we can the uptake of these actual molecules, psychedelic molecules, will work with our carrier or our delivery technology, and really show more data from there and the efficacy of it. So we know it works. We're confident, but the reason for the study is to really not tell you about it, but show you with data and back it up. And we're quite confident we'll come back with really great results that will drive some more interest from the industry experts and those that want to work with us.